All set. Hello, everyone. I'm Coletta Dorado. I'm the founder and CEO of AZZLY, and I am your moderator today. Why this topic, you might be asking? Well, with payroll costs going up and payer reimbursement staying pretty flat, it's critical that you build a solid foundation to launch from. As a fellow entrepreneur, I know that the need is great and that this is a growing sector of healthcare, and you all have a phenomenal opportunity to really serve your community and have a successful business. But you have to do it right from the start. We are being approached by more and more entrepreneurs that are committed to provide a better treatment experience in their community. But what we also find is that they skip doing it right sometimes from the start. So what we're trying to do is share with you some very positive success stories, and also the experience of using an experienced credentialing expert, how important that is. Shortcuts can't be taken at the beginning. It is critical to do it right. Many times we find that the piecemealing approach of many different softwares in order to build that platform to grow from isn't always successful. And basically it costs you more time, more money, more frustration, and really staff burnout. So whatever the reason for your passion and commitment, we salute you. We're here to support you. And we want to share these best practices to assure your success. So let's get started. If you have any questions for the panelists, there's a QA section on the bottom of Zoom. You're probably familiar with it. We're going to address some of the questions that came in prior from those that are attending and get to as many as we can at the end of this webinar. So, Andrew, are there any other relevant slides you want to go through, or can I kick it off and introduce? Okay. Heather Workman. I'm so thrilled that Heather was available to join us today. Heather is a multitasker. She's Director of Operations for Serenity Health and Wellness in Northeast Ohio. We've had the pleasure of really seeing a tremendous growth in Serenity Health and tremendous growth in Heather. She will be sharing her experience today. I'm really pleased, Heather. Thank you so much for joining us.
Thank you for having me.
You're welcome. And also, we're grateful to have from the AZZLY team, Carol Gorbett. Carol is our behavioral health credentialing expert. She's got over 15 years experience. We're extraordinarily impressed on those facilities and startups, and even those that are expanding their locations or programs and the services that they offer. Having Carol get involved with them, we've seen results so quickly to really help them build that foundation. So I wanted Carol to come on board, and I think we'll get started with Carol, you today, to talk about credentialing. What is credentialing and why is it so important, Carol?
So credentialing is submitting provider and group organizations and facility, submitting their information to the payers so that they can process the provider and facility group applications so that the group can get reimbursed for services to their members. And it's an important piece of the process because that's how you get paid. Basically, by submitting a claim to the insurance companies and then getting reimbursed for those services. So credentialing equals money.
There you go. Carol, for how long does the process take for a startup that's just trying to open up their doors? Do you have any tips to share in regard to that?
Yeah, so the process can be lengthy. It could 3 to 6 months to sorry about getting a call. It could take 3 to 6 months to get contracted and credentialed. What I mean by contracted is, and this is a misconception, and I like to explain to any of the potential entrepreneurs who want to get credentialed. What I mean by contracted is the organization has to be contracted with the insurance companies, and then the providers underneath that facility or organization need to be credentialed. So the contracting piece is what can take a long time. A lot of times providers say, well, you know what? I just came from an organization and I know I was credentialed. So shouldn't the process go faster? Not necessarily, because you have to get contracted. They know the provider, the insurance companies know the provider, but they may not know your business. The business itself is new to the payers. So that's where the length of time comes into play, is the contracting piece that has to happen as well as credentialing.
So Carol, if they're going to be servicing the Medicaid market as well as commercials, is the Medicaid process fast? Or is that a slower process? Is that something you should tackle first?
It is. If you want Medicaid, it can make the process take a little bit longer, because a Medicaid enrollment with the state has to happen first. So you enroll the provider or the group or organization with the state first. Once that approval comes back, then you can go to the other insurance companies, the Medicaid expansion plans, what we call them, and then you start the credentialing contracting process with them. So you add that 30 to 45 days onto the process if you want Medicaid.
Excellent, Carol. Thank you. Okay, Heather, let's talk about how long have you worked in recovery centers?
So I've been in recovery centers for about 4 years. I've done medical billing for 20. I have done credentialing for about 15 of those years. But I love substance abuse, mental health. It's great. The process to get started is a little bit extra, because we have to go through an extra board in order for us to start our practice. Other specialties don't always require certification through a board in order to start an agency. However, Ohio requires that we go through an organization called OMAS, which is Ohio Mental Health and Addiction Services.
So what roles do you play? Your operations, did you wear many hats as a startup? Did you have to wear many hats to get this going for Serenity?
Yes, so I started off as a house monitor in the industry. I also did counseling. I am a CDCA. I'm also a peer supporter and a registered applicant. So the registered applicants for prevention, peer support is for both mental health and substance abuse, and the CDCA is for the chemical dependency. So when I was getting started, I started off here as a house monitor. I started working on the billing, and within 3 months, I became the operations manager with all the credentialing, registering all of our state license through the state of Ohio, getting malpractice insurance, making sure that we're covered, so that when we went to go credential with the insurance companies, we had all the proper paperwork.
Excellent. Is there anything you would have done differently from when you started working with Serenity and they opened up their doors? Any recommendation that you'd give to anyone from leadership or management that's on the call?
I would say take one project at a time. Start working the project, figure out the details to that one project before you start adding a bunch of services, because there's a lot that's included in each service that you provide. There's a lot of documentation. There's a lot to the process, making sure you have protocols in place to make it safe for your clients or your patients. So that was definitely something that needs to happen. First and foremost is decide what is the first steps you're going to take, come up with a plan on what you want that to look like, and then implement it. I would say one of the don'ts for us was we jumped right in and we just started trying to provide all these services. And when we went to get certified through OMAS, it became an issue. We had to withdraw some services because we weren't fully established in all of them yet. So we had to pick and choose which services we would continue with our audit and which ones we're going to withdraw for the time being.
Did you also get Joint Commission or CAR for COA?
So we are currently in the process of getting our COA accreditation. OMASH just, as of October 3rd of this year, requires it now for the licensure. So we are just starting that process. We did look into CARF and JCO, which are both very good also. We went with the COA because of the mental health component. For us, they handle both mental health and substance abuse.
Excellent. So talk to me about technology decisions.
So, technology and your software is key when you're getting started. You need to make sure that you have a software that is going to be good for what you're actually doing. If I could have invested in a better software from day one, that's what I would have done. It's very hard to be in the software where you're just doing clinical notes and there's not a lot of capacity for billing. Because like Carol had said, it's great that you're doing the services, but if you can't get reimbursed for those services, then it's kind of a waste of time. I can't get paid for services if we don't have a good billing system. So for us, the investment in AZZLY was huge because it had both the clinical side for us for our electronic health records, and it also had the capability for us to bill ourselves.
Excellent. Carol, you know, on hiring new licensed providers, is it often overlooked that even though they were credentialed or contracted at another facility, and I know there's a lot of per diem where providers are working for other treatment centers, is it critical that they get credentialed at that treatment center, even if if they're a per diem, they're not, they're contracted?
I'm sorry, Coletta, was that a question for me?
It was a question to you, Carol.
I'm sorry, I'm having technical difficulties over here. Sorry about that. What was the question again?
Okay, so we're noticing a lot of contracted work, per diem, for provider work, if they're a specialist and they want to provide services at another facility. Do they also have to be contracted and credentialed at that facility?
I apologize. Yes, they will. Wherever you go, you have to be credentialed with the facility that you are currently working at. I have providers who supervise at multiple organizations, and so I would have to credential them at each location. Now, they may not need to be contracted because the group already has the contract, but the provider would need to be credentialed and or linked to tax ID.
Okay, excellent. Heather, back to you.
Yeah.
Talk to us about site surveys. How do you get it done successfully?
So when you do your site, we use a system called LAT. It's through Ohio ID. We registered through Ohio ID. Then when we get into LAT system, you fill out a big, expansive application. You attach all kinds of documentation such as fire and occupancy, employee documents. You give them a list of all the people that will be working for your clients. Once you submit your application, you have about 1 year from the time that you submit that application to start providing services and to show that you are able to do those services according to their standards. After the year is up, the auditor will send you an email, and through that process, she'll send you what they call checklists. And each category or each service that you provide has its own checklist. And so you go through all of your records, you make sure that you're compliant with all of those components. They set up a date. What we did was we took binders, and for every category, we took that checklist, we put it in the front of that binder. We took notes or examples from that checklist to show that we were compliant, put it all in a binder. When the auditors came, we stuck them in a separate room, gave them access to our software with the 5 clients that they were allowed to see. and then we left them in the other room to do their audit. Periodically, they would come out and ask questions or tell us that we weren't allowed to do certain things. But then they gave us 30 days from the time that they were here. Any citations that we had, any changes that we needed to make to forms, we had 30 days to work with the auditor. It was an open spreadsheet, so I would send her stuff and then she would comment back to me, and then I would fix it. And then once you're all done with the auditor, she gives you your official certificate, and then you are good. I believe regular certification, depending on when you start, it's 2 to 3 years. So it just depends on if it's in the middle of the year or if it's the end of the year, but it's about 2 to 3 years is the certification before you have to renew.
Excellent. You know, Heather, we created an auditor role in our software in AZZLY to allow for a narrow view on what is required to be audited. The reason we did this, it was shared that many organizations would allow for the auditor to stand behind the provider and start going through chart after chart after chart. And the more they saw, the more questions they asked, and it never stopped. And so by developing this auditor role, it gives the auditor that view of exactly what they want to see in a very clean, sortable, filtered view that certainly helps keeping them focused and getting through an audit much easier.
And we did use that when they came out. I did add, I made clients, they were called OMOS Auditor 1 and Auditor 2 for my users. And I did use that auditor function in AZZLY when we did our audit. So it worked.
That's what's important. It's got to work for sure. So Carol, I know that you've come to the rescue of some startups that thought that they had a great credentialer, thought that they knew what they were doing and doing it right in contracting as well as credentialing. Can you talk about some of the pitfalls that new organizations should try to avoid, maybe some do's and don'ts, anything that you can give them as far as a tip that might help them recognize that maybe the individual they're working with doesn't have the knowledge base that they need?
Right. So, yeah, I get this question a lot, and I've seen it a lot, because you don't know what you don't know, right? So I would ask the credentialer how long they've been working in this field, what type of specialties they've worked with, because behavioral health is different than medical. Facility credentialing is different than individual credentialing. I would talk to someone who has vast experience with all different types of specialties. I would try to avoid doing this process yourself. If you don't understand the credentialing process, find someone who can help you with this process or has the vast experience, because it's just getting, I call it unnecessarily complicated. There's so many different variables to this process, and each payer wants something different. And so you need to find someone who has the experience with dealing with the different variables and the different situations for each specialty. And then I also want to add that if you want the Medicaid piece, the enrollment process is quite different than the commercial aspect of credentialing. So again, just find someone who has the expertise to do this, because if you do find someone who really doesn't know what they're doing, they can submit the information all day long and the payers will process it, but it'll be all wrong. And then you're going to have billing and claims nightmares. So you're going to have to reach out to someone who knows what they're doing and they're going to have to unravel all of all the mess up. So I just would recommend finding someone who has the experience and asks the right questions.
Great advice, Carol. Thank you.
Mhm.
You know, Heather, on the timely filing, you know, it's excellent, your billing background. It is critical because, as Carol mentioned, and you, getting contracted, getting credentialed, it's all about getting paid. And we have seen, unfortunately, many startups who didn't follow the process correctly, provided services, didn't get contracted right, didn't get credentialed right, timely filings, and all of a sudden they've provided wonderful services and they're not getting paid.
So, in regards to timely filing, so I feel like when you start an agency, you should assume that during that credentialing process, some of that first 3 to 6 months, those services they're going to be a write-off for the most part. Unless you get authorizations, I will say fight for those authorizations. We did our hardest to try to get authorized for what we were working on. However, due to behavioral health, the levels of care were higher than the insurances wanted. So they didn't really want us to provide those services. But moving forward, definitely making sure that you send documentation. When you get timely file denials, it doesn't mean that it's over. We still have rights under the insurance companies to appeal claims. We can still send in proof of evidence, if you want to say. And so when I get timely filing denials, I submit the proof. I go into AZZLY, I print off our claims reports, and I attach them to paper claims, and I send them off to the payers to show that, yes, we did submit those claims. Medicaid, a lot of their payers are about a year from date of service. Commercials, usually about 90 days you have from the date of service. But one thing I will say is, even if you know you're not going to necessarily get paid on that claim, send it out, because it shows that proof electronically, and when you need to get paid, you have proof. So there have been times where I know the claim is going to deny, it's not right, but I still send it out because I want that digital proof, and then I can fight the insurance company, whether they decide to pay or not. That's not up to me, but I can try to appeal those claims and try to reimburse that money.
Brilliant. You talked about two functions and features that we added in AZZLY based on our user feedback, and it was the countdown of prior authorizations. I don't know if you're using that in the system, but whereby you get the number of authorizations, whether it's 10, and as you submit claims, it counts down on your behalf. Do you use that feature in AZZLY? Have you used it yet?
So we have used it when we were getting authorizations, when we were billing for PHP, we definitely were using it for the authorization process. We're mostly billing IOP now, and we finally are in network with all Medicaid payers. So I don't have to worry about authorizations anymore, and now I just got to worry about modifiers. But yeah, we definitely have used the authorization, and it's very helpful when you're billing a bunch of stuff, especially substance abuse and mental health, because they're here so often that trying to catch those visits and trying to figure out how many times you saw them that week, it's a lot if the software is not there to help you.
Excellent. The other thing we did to try to assist in sending medical records to a payer is in our eChart, which is a chronological listing of all the medical records and services you've provided a patient. We have a secure outbound eFax where you can select the records that you want to send, the charts you want to send. It will create a cover sheet and list it, and you can securely fax it out of AZZLY, out of the eChart. We've gotten very positive feedback on that, because it gives you exactly what you said, that paper trail that did it, and then it can drop into what we call patient documents. So you've got not only you've got that cover sheet and everything listed, but you also save it. So if a payer should say, I didn't receive it, I don't think you sent it, something must have happened. You've got proof that it was sent and acknowledged. So again, that's what we strive for as a technology as a service company, to create the platform that you can bring in all of your needs, your requirements, as you recognized as you grew from a startup to your existing business, that you need in order to run a business. We've brought those features and functions into one platform. So, Heather, it's been a pleasure to work with you. It's been a pleasure to see you grow. Carol, you've been a savior to many a young startup that we've referred you to, and recognize the value of a good credentialing person, an expert, to walk them through what has to be done. So I just really want to thank you both for sharing your knowledge, your experience with the attendees and with us today. Let's see if I have a couple questions. Can I get ahead of the Joint Commission CAR-for-COA by using master forms that already meet compliance standards of care? Heather, is that critical, the documentation, the forms you use?
So yeah, so when we did our OMOS, there was actually a number of things we did have to add to the forms, but I will tell you, it's great. I use client services. So if you're an AZZLY customer, use that. I email them all the time. They get back to me in 24 hours usually, but all I did was I used that master form. I edited exactly the way that my auditor wanted our wording to be. Some of it was already incorporated, but she wanted it to say something specific. So what I did was I printed that off, I adjusted it, and then I sent it back to client services, and they, within 24, 48 hours, fixed all my forms so I could submit them back to the auditor. That's what I do. I mean, if there's any issues with any of my forms, I submit them to my auditor and ask her. As much as auditors scare us, they're also there to help us and to keep us compliant. So as much as, my auditor, she makes me nervous when I get an email from her. At the same time, it's also good because she is there to make sure I'm doing what I need to. And if I do have questions, she's there to assist me. So don't be 100% scared of auditors, because they are still there to help you.
I love it. What an honest reaction. So I want to be timely here. We just have a few minutes left. Carol, any last comments? Thank you so much for attending today. Any last words of advice?
I would say trust your experts. I definitely recommend finding someone who knows the process, who understands the process, ask questions. The biggest thing that I could say to a startup is find out what documents you need, find out what information you need to get started, put it all in a folder, have everything at your fingertips, and when you're ready to go, shoot that information off to the people that need it.
And we did have one question that came in Q&A, and it was in regard to understanding contracting versus credentialing. Carol, can you just review that quickly one more time?
Sure. Contracts are the agreement between the organization and the payer. This spells out what the payer expects from the organization. You now have an agreement with the organization. The credentialing is verifying the provider's credentials. Are they who they say they are? And then to add on that, there's enrollment, and that's your state Medicaid and Medicare. So you enroll the providers, you enroll the group, you get the group contracted, and then there's credentialing. Hope that helps.
Jackie, I hope that helped. And again, if you have any further questions or need some additional assistance, it's client services with an S at AZZLY.com. Submit. Heather knows that well. Submit it there, please, and we'll follow up with you. And if you're having some issues, I'm sure Carol can assist on that. Heather, any last words? You got 1 minute left. Any last words of advice?
Just jump in there. Don't be afraid because that's how you're gonna learn. That's pretty much what I've done is if I didn't know, I asked AZZLY or I asked somebody else, looked it up. But just don't be afraid. That's really what I'd have to say. Just jump in there and figure it out. You're gonna make mistakes. That's gonna happen, but that's how you learn. So that would be my advice. Jump in there, full throttle, you know?
Listen, you survived Ohio and all the things that they've put you through. So to you and others. Thank you, Heather and Carol, once again. Thank you, all the attendees. We really appreciate your joining. We hope that you found this helpful. Tell others. AZZLY, we're here for you. Have a great day and a wonderful Thanksgiving coming up.
Thanks.
Bye-bye.
Thank you.